All right, well, I think some numbers is worth just bearing. So we have, in 2015 number, 2 million Americans with a prescription opioid disorder, and about 600,000 with heroin disorder. The total cost of opioid overdose abuse addiction is estimated about $78.5 billion. And the overdose, from drug overdose deaths, take the lives of 142 Americans each day. Someone did a math and say that death toll is equivalent to 9/11 every 3 weeks. These are big problems. And I would say that if we look at our recent data on life expectancy, we begin to see a flattening life expectancy in this country, but it's mainly due to a separation of different socioeconomic groups, and certainly drug overdose and opioids are attributed, is one of the factors attributed to this. So we're here today with a number of distinguished, outstanding individuals who are really in the midst of all this crisis trying to deal with it. And I thought that we actually have different perspectives, or maybe all the perspectives. But importantly, of course, I just like to frame the conversation by saying we recognize there's an overprescription problem. And that's one of the factors. In fact, U.S. prescribes 4 times more than any European countries in terms of opioid. And that's an astounding number from my perspective. In 2015, the total prescriptions of opioid exceeded 225 million, which is a prescribing rate of 71 prescriptions for 100 people. So try to think about how we can get there. It's quite a story. Then, of course, treatment. Treatment, we totally failed in treatment. You know, the Hopkins study showed that 80% of people with opioid addiction are not getting treatment. And furthermore, 9% of substance abuse treatment facility, only 9% offer specialty or specialized treatment with medical assisted treatment. And of course, the regulation restrictions make access to MAT, we should talk about, is really quite substantial. So, as you heard, many doctors just don't want to treat. It's not only stigma, it's paperwork, it's no reimbursement, it's having to go through all that work. And then consider all the other services that's required, counseling, stable income, and income assistance for long-term recovery. So how do we make it easier is the question. We're not getting enough, certainly, training. It's been pointed out that most clinicians don't get very good training in pain or even on addiction. But also the issue of reimbursement, incentive, you know, are important issues for us to address. Categorizing illicit opioid use as a criminal justice problem rather than public health crisis is yet something else that I think most people see as a failure of our system. And we probably should be discussing that. You know, it's a moral failing, and you know, you deal with mass incarceration, and of course the cost is substantial, and there's no evidence that you can reduce this problem. And then finally, I see this as a major socioeconomic issue. You know, this is in fact a disease of despair, as someone said earlier. And so the vulnerable population, in terms of now increasingly being addicted to this, how can we address this larger problem of a social, economic, and other factors in this country? So that's the setting for today's discussion. And as you know, we at the National Academy are very sensitized to this issue and feel that we must do our share. I think Gil Oman showed you a report that we have recently published, released, called the Pain Management and Opioid Epidemic, commissioned by the FDA. And among many recommendations is one to say better incorporate public health consideration in FDA's approval and monitoring framework for opioids. I know Scott's going to talk about that. We also work with the NGA, National Government Association, and release a paper on for clinicians to prioritize non-opioid strategies to manage chronic pain. So with that background, I would say that it's clear that this epidemic is a multifactorial problem, and we need multi-pronged, multi-sectorial approaches to addressing this. I don't think any single sector of government agencies can solve this alone. And so this is why we assembled this distinguished leader, the panel of distinguished leader, to share their observation, priorities, and really talk about policies and solutions. So let me first introduce the panel. To my left is Governor Charles Baker, or Charlie we call him, in Massachusetts. Governor of Massachusetts, a leader in healthcare, and he also serves on the President's Opioid Commission as chair of the NGA's Health and Human Services Committee. Welcome, Charlie. Next is Secretary Kathleen Sebelius. She's now the CEO of Sebelius Resources, former Secretary of HHS, but also the former governor of Kansas. And Kathleen is here particularly because she co-chaired the Aspen Health Strategy Group together with Governor Tommy Thompson, and we hope we hear from her some of the findings from that particular group. And of course, we have Dr. Scott Gottlieb, the Commissioner of FDA. He's a physician, medical policy expert, and public health advocate who previously served as FDA's Deputy Commissioner for Medical and Scientific Affairs, and before that, Senior Vice to the FDA Commissioner. Welcome, Scott. And we have Judge Stephen Leifman, or Leifman. Did I get it right?
Leifman.
Leifman, great. He is administrative judge for the 11th Judicial Circuit Court of Florida. Judge Leifman is one of the nation's foremost authorities on the criminalization of mental illnesses. And of course, last but not least, welcome Dr. Jerome, the U.S. Surgeon General, prior to which he was the State Health Commissioner of Indiana and anesthesiologist by trade, and also worked as assistant professor in anesthesiology at Indiana University. So welcome to all of you. So each one will have 5 to 7 minutes.